Welcome to the National Center for Pyramid Model Innovations webinar. Actually, we frame this as a conversation with NCPMI faculty. I'm so glad to have you join us, and thanks to all of you who answered the survey that helps us figure out what your needs are. This really is a conversation about some of the challenges we're all confronting and some of the faculty to help you think about those challenges. So I'm Lisa Fox with the University of South Florida and the principal investigator of NCPMI, and I have two of my favorite colleagues with me who will introduce themselves. Erin?
Hi. Thanks. Yeah, thanks, Lisa. I'm Amy Hunter, and as Lisa said, I'm faculty on NCPMI. I'm an assistant professor at Georgetown and really excited to be here with all of you today.
And I'm Erin Barton, also faculty on NCPMI, and I am an associate professor at Vanderbilt University.
We have the survey, and many of you responded, and we thank you for that. And from that, we found kind of some of the top challenges that we thought would be really great to begin our conversation about. And really, we're going to, let's walk through the survey, and I think you might be interested in what's on everyone's mind and how they're delivering services, and then we'll jump right into some of the challenges that you're confronting. So we've had many more responses than this one over the last few days, but when I pulled this, the top way that people were communicating with families was touching base phone calls and email check-ins, and providing resources to families. And you can kind of see the breakdown from those touching base phone calls all the way to live teleconference sessions for families with children. And as we looked across all the responses, we saw that sending emails, sending materials, having teleconference sessions, using telehealth for the provision of early intervention services, or using an app that might be your school or programs app or your website to deliver information to families seems to be what we're all busy trying to figure out how to do and to do well. When we asked you about your concerns, the top concerns were around families and families coping and helping children with emotional and behavioral difficulties, as well as families' capacity to help their children in times of really extreme and I would say unprecedented stress that's going on currently with a pandemic. And as we looked across all those challenges that you had listed, we see that a pressing one is around coping with kids' behavior and kind of managing everything that goes on at home. Family stress from change in their work routines and change in routines for children and children's reactions to changes in routines, helping families navigate priorities, and then family availability. Many people, if they are working remotely, and families have a lot to cope with, getting food, responding to employers, as well as guiding their children's learning activities. And so that's what we learned from you. From that, we decided we wanted to talk about a few of these things because I think we're really well poised to help you think about the strengths that you have and the ways that you can use your capacities, your pyramid model knowledge to be able to support families as they navigate. So the first question we queued up was around providing help to a family without adding to family stress. And I thought, Amy, maybe you could start with helping us figure out how to respond to that.
Sure. Thanks, Lisa. And this, I just love this question. And I know it kind of bubbled up out of the survey as a really important topic. And I've heard this question in many other realms, you know, talking to providers. And the part that I want to hone in on first is this family stress, right? You alluded to it, Lisa, but families, I think, are, you know, in a position at this point in time to be very stressed. And so I think just acknowledging that, you know, whether they're worried about someone being ill, whether, like all of us, you know, we're all in this together, whether we're worried about getting ill ourselves, whether they're worried about someone who's been sick, or, you know, heaven forbid, someone passed, worried about finances, you know, all of that, just even to acknowledge a few. And so I think, you know, keeping that family stress in mind when you are thinking about providing services or touching base is such an important aspect to acknowledge. And so, you know, I was thinking about this, and I was thinking one of the most important aspects of sort of how to balance this, providing support and acknowledging and supporting family stress, is helping families sort of see what they value most and the long view of this, right? And so helping families, you know, sort of recognize the most important part of this really challenging time is spending time, you know, as a family, and valuing that family time. And, you know, even with all that there is to do, seeing if they can find, you know, even 15 minutes with their child to have that undivided, you know, child-focused, child-driven playtime, and trying to find the joy, you know, in this time with their child. So I think, you know, those are some of the pieces. And, you know, I think asking families where they're at with this, you know, what is most stressful about the situation for them? You know, how have routines changed? Is there any aspect of this situation that is surprisingly better than they thought it might be? You know, trying to focus on, you know, yes, like let's identify the sources of stress, or what is most difficult about the situation. But also, you know, are there things about this that are pleasantly nice? And so trying to kind of balance that. It might be helpful, you know, when you ask families about what might be most difficult about this, to then, you know, think about, are there ways that you can help families feel a reduced stress? You know, if they're worried about, for instance, meeting their child's academic needs, or doing all that they might feel pressure to do, you know, for their child, thinking about how to build those strategies into routines, right? You know, helping to remind them that those daily routines that they're doing anyway would be probably the best place to help their child learn, you know, whether it's helping cook a meal, or, you know, having that interaction at bath time, or, you know, reading stories before bed, and, you know, kind of building in that time during those routines that they're doing anyway. And, you know, if families are feeling just pretty anxious or spun out, you know, you can certainly help them think about those mindful moments. You know, if they feel particularly stressed, you know, making sure their child is safe, you know, thinking about infants and toddlers, you know, they can, if their child is in a safe space, they can walk away. They can take a couple deep breaths, you know, and helping families feel like that's okay. You know, as long as their child is in a safe place, they can certainly take the time for themselves, and, you know, sort of reminding them that, you know, put on their air mask first, right? And in order to help their child, they got to help themselves. And so helping remind families of those mindful breathing, those grounding activities to sort of stay present and meet their own needs. So those are a few ideas that I had. I know, Erin, you have ideas as well.
Yeah, I mean, just to build off those are great. I think one of the things that I keep thinking about too, that is so important for families to remember, is that this is incredibly hard for all of us, and none of us have done anything like this before, experienced anything like this before, and it's not going to be perfect. And so, I mean, to build off of what Amy said, I think what is critically important when we are talking with and connecting with families is to remind families and caregivers to take care of themselves, and that they're going to have to really engage with and think about their own stress levels and to practice self-care so that they can create nurturing and responsive environments for their child. And, you know, I love what Amy said about thinking about the routines in the day. And I think, you know, if families are experiencing lots of stress and you're hearing that from families, maybe ask them if there are routines that are working. You know, what are the parts of the day that are working well, and build off of those and use those as times when, which is really what Amy said, to use those as times when they can connect with their children and maybe engage in play activities, or maybe it's just, you know, a back and forth interaction that's working. Maybe that's just reading a book to a child, to their child. But thinking about what are the times of the day that are currently working well, and how can we build off of those, and how can we make, you know, minor changes to those to create more connections throughout the day. Because what's most important is that children are supported socially, that the child's social emotional competence is supported right now, and that parents are able to think about creating and able to create nurturing and responsive environments at home for children, so that we are able to respond to children in meaningful ways and help them engage in the environment in meaningful ways. And then the other thing that I think is really important for us to remind families of right now, that there might be days that are better than others, and every day is a new day, and that they might have one day where homeschooling goes great, and they might have one day and the next day where it doesn't happen at all. And, you know, that's just gonna be how it is, and that's just gonna be fine. It's not gonna be perfect. This is, you know, an incredibly challenging situation for many of us. For many of us, there are things that we just can't control about the environment. And so this isn't, you know, a time to focus on doing the best homeschooling we've ever done. It's really a time to focus on, you know, supporting that connection that we have with our children.
Yeah, and I couldn't agree more, Erin. And before we leave this question, I just had a couple of more thoughts that I want to make sure we sort of touch base on. And one, I know we're doing, you know, social isolation, or I don't know if that's the right word, right? We're staying away from people, but that doesn't mean that we can't still be connected to one another. And so if, as a provider, you're hearing families, you know, talk about their stress or talk about their anxiety, you know, really help them think about, who do you talk to that might help you feel better? Or who do you talk to that you can share some of this with? I have found, you know, even in our work, you know, kind of sharing a little bit, as you did, Erin, about how we're all in this together, and we all have days when we're feeling a little bit better about what we're doing than others, or a little less motivated. And so sometimes we worry about our boundaries, you know, and what we share personally. But I think having those universal experiences can be helpful, and, you know, encouraging them to talk with other families over the phone, or to, you know, reach out via text to let people know how they're feeling. And then we know that during times of increased stress, there will always be increased concern about things like child abuse and neglect, domestic violence, and increased substance use. And so I just want to kind of make sure that's kind of on our radar. And I have heard providers, you know, talk about, well, families aren't sharing that with us, and that's okay. It would be very expected that families might not share that with you right now while they're in it. It may not be safe to talk about it. It may be just, I need to get through this, and then you might hear more about it afterwards. But I would encourage you, if you do have concerns, if you do hear about things that you're concerned about, here are some national numbers for you to have available. And you would also probably want to have your local numbers available for local services in each community that you're from. But, you know, just keeping those concerns on the radar so that, you know, you have an awareness about that.
Thanks so much. So should we move to the next question? We have a lot, and we have some in the question pod as well. Before I move forward, a couple people have said, oh, my colleague just texted me and they can't get in. So unfortunately, lots of people registered and we kind of lost control. And we had many more that could get in the room. We will post this. So if your colleague is texting you, you could say, oh, they're going to post it, and they apologize. They apologize. We don't mean to add to anyone's stress or disappointment. And we will post it, the recording, and they can watch it. We'll also, initially I didn't know people would want certificates and they would be in high demand, but I will figure out the certificate part and we'll include that as well. So let's move to the behavior part. So we know that that's occurring. You said so, and you want to help families do that, but we're not right there in the room. So how do we navigate that?
So I think I want to go back to and just remind all of us about something related to that we talked about with the previous question, and that's that we really want to remind families to take care of themselves, because one way that can make challenging behaviors worse for young children is when parents are really stressed themselves, or caregivers are really stressed themselves. And so this might be a time where, as Amy said, we encourage caregivers to really think about who is in their support system, and it might be an even more important time to reach out to those connections via FaceTime or Zoom, whatever it is, to connect with people who are supportive, whether it's, caregivers, friends, or family, but to make sure that caregivers are not feeling isolated right now, and that they do have some support system. And so encouraging them to do that can be critically important. I think another really effective and perhaps important and feasible perhaps for lots of families ways to support and to prevent challenging behaviors is to support families in thinking about what their day looks like, and to support families in creating a day that's somewhat predictable for children, because we know when children know what to expect. Now, again, it doesn't have to be at the same time. It doesn't have to have anything to do with time. But when there is somewhat similar or predictable order of events, then it can be easier for children to engage in the environment, and it can help prevent challenging behaviors from happening in the first place. Another really effective way to support children who engage in challenging behaviors is to make sure that children understand what the expectations are, and that if you are going to expect children to engage in maybe a difficult task or a task that is new or might be more demanding than usual, then to make children, to help children understand exactly what the expectation is, and maybe pair it with a really preferred activity. So maybe they do, a little bit of reading, and then after reading, they get to use their iPad for a little bit of time. So helping children understand that they might have to do something hard, but they know exactly what it's going to look like, and they know when they're done, and they know that they might get something cool when it's over. Another thing that can be really helpful for preventing challenging behaviors is, if you are going to start a new activity, is to use some sort of transition warning. And so it could be that you use a timer, it could just be a visual, like a gesture, or it could be that you actually, draw a stop sign on a piece of paper and tell the child that they have, 2 more minutes. With older children, you can actually involve older children in identifying when a transition might happen. So, do you want to play with blocks for 2 more minutes or 5 more minutes? And, most of them are going to say 5 more minutes probably, but engage them in making choices about when the activity might be over or when something new might happen. And also remember that now is not the time to expect to be perfect, and know that, help families understand that there are going to be days that are hard, there are going to be days that are better, and they're not going to be perfect. And, we're putting a lot on families' plates right now, and there are a lot of additional stress stressors that are happening for families. And so supporting families and understanding that now is not necessarily the time to teach their children a bunch of new skills, that now is the time to just, get through the day and continue to support their child's social emotional competence, make connections when you can. Another thing that will be important for families to start to think about is to have conversations with children about what they're feeling, and let children talk about what they're feeling, and validate their feelings, and know that it's okay. Families to remind children that it's okay to have these feelings, and talk about their own feelings too. That today they're really happy because they got to FaceTime with grandma, and but they were disappointed because they couldn't go to school, or they had to cancel, couldn't go to a party that they wanted to go to. So encourage families to talk about their own feelings and their own disappointments, and also the good things that are happening, and to model that for children.
Erin, do you want to, we loaded some of the resources. Do you want to share some of those, or Amy, do you want to respond?
Sure.
And then we can share them? You want me to click through them for you? All right. So we have this one.
Mm-hmm.
And what it doesn't show is the flip side that has some really nice tips for families about how do I respond to children's challenges. That's on the opposite side, but I think it touches some of the points that you just made.
Mm-hmm.
Want to talk about these, and I'll flip through them for you?
Yeah, so this is, so all of these can be found on our Instagram page and our Facebook page for my research lab. So it's the Barton Research Lab. So lots of these, we've created all these infographics to distribute during this time, because we thought that they might be useful for people who are working with children and children and families themselves. And so this is an example of a prevent strategy. So this is something that we would encourage families to use throughout the day. And it's different types of transition warnings. And they're things that really probably are happening in early childhood classrooms and are potentially feasible and easy to embed throughout the day for families at home too. So you might give a verbal warning, and that might be perfectly acceptable for many children. And it could just be, 1 more minute, and then we're going to clean up the blocks and go do some math work, or 1 more minute, we're going to clean up the blocks, and then it's time to take a bath. You might use familiar songs like the cleanup song, and that can be something that the child can engage with as well. And there's probably a cleanup song from your child's classroom if your child was in a classroom, or you can just make up a song too, and use a song and then use it throughout the day when it's time to clean up. Visuals are great, and they don't have to be perfect. I use visuals with my son all the time that I just draw. And I am not an artist. They're not good drawings. But it's an added cue that helps the child understand what's happening next. You can also use timers. I mean, lots of us have timers either on our phones or on a microwave. And you can use a timer just to remind the child, and you can have the child help you set the timer. And then I mentioned this a little bit before, but with older children, you can get them engaged in, what the transition might look like. So, how many more pages do you want to read, or how many more blocks do you want to use before it's time to clean up? And getting them engaged can help with the transition. The next one is positive descriptive feedback, and this is something that can happen all day long. I have this printed out actually on my fridge because it's so helpful for me to remember, and it can be done all day long. And again, it's not necessarily saying good job cleaning up, but it's telling the child that you appreciate what they did, and reminding them exactly what they did. So, you're working so hard to put your shoes on, I'm so proud of you. Or, wow, you did such a good job getting your pajamas on. That was really hard for you, and I love how you did that. And so it reminds the child of what the expectation was as well. And then this is a great one for when the child has engaged in challenging behavior, and also is really important for me to remember. What can really make challenging behaviors worse is when parents or caregivers, adults respond in a reactive way to the challenging behavior, because it is stressful to see young children engage in challenging behaviors. And it's difficult to watch children suffer through that. But what we have to remember to do is to remain calm and to avoid reacting in the moment. And then once the child is calm, then we can provide help and respond to the child. And sometimes that involves the adult walking into another room or making sure the child is safe and go, into the other room and taking deep breaths, or standing on the front porch and taking deep breaths, or counting to 10. But what this is really important for remembering is to try not to react when the challenging behavior is happening, because oftentimes that makes it worse.
I'm sorry, I got caught up in the question queue. People are excited about the resources. I think they want you to state again. It's on the bottom of this one, the URL for Barton Lab. And then NCPMI is also posting them, and you can get to Barton Lab through us. So.
Yeah, if you go to my Facebook page, you can get to it easily. If you search Instagram for Barton Lab, you will get Barton Lab, and you also get some Barton Labrador breeders. I am not the dog one, although I could be, but that's not me. And then I love this one. This one is really important to remember too, related to the one before it, but these are some strategies that caregivers can use when children engage in challenging behavior. Because like I said, it's really stressful, and it doesn't feel good to watch your child engage in challenging behavior. And so it's helpful to think about what they can do. So counting to 10, taking deep breaths. I love thinking about looking for opportunities to challenge your child's behavior. Thinking about reflecting on what the child might have been feeling, and remember that, children are, watching us and watching how we respond to these additional stressors. And if we're stressed, which many of us are for good reason, they might be experiencing stress too. So it's great to think about staying calm, connecting, and reflecting on what's happening.
That's great. Amy, do you have thoughts too about how to help guide families first to realize kids are having challenging behavior might be part of that? And how do you navigate those conversations, or anything to add to what Erin has shared?
Yeah, sure. Well, first I wanted to, I love these resources. And as you said, Erin, we all need these reminders. My children are older now, but these same strategies sort of circle back, right? Mm-hmm. But one of the things I wanted to sort of bring up is thinking about specifically the infants and toddlers, and how even infants really pick up on, as do all young children, but including infants, our emotions. And I just can't reiterate enough about what Erin was saying, sort of how do we regulate ourselves when we're feeling anxious and sort of zoomy inside, and or even angry, or any of the range of emotions that we can expect to feel during this time. Sort of how do we calm ourselves so that we can help children and to co-regulate with how do we help parents to be able to do that, so that they can really be that calm, that grounded presence for their child. A couple other sort of ideas that I have heard about recently when you were talking about visuals, Erin, is I have a colleague who does a lot of these, right? A lot of the webinars and meetings and things. And, the colleague set up a red light, green light with paper, sort of when the red sign goes up, that's stop. That's, try not to interrupt me. And when the green paper goes up, it's okay, let's talk. This is an okay time to be interrupted, and trying to help nuance that, sometimes are more important than others not to be interrupted. And sometimes it's okay. I love what you said around one of the things that helps me remember this is this idea of connection before correction, and thinking about, how do we maintain our relationship? How do I help validate your feelings? How do I help us both get calm before we talk about, correcting the behavior or talking about how to do something differently, right? Those teachable moments. So I guess one other piece that I would say is there's going to be challenging behavior. There's going to be disruption in relationship. There's going to be big feelings on the adult side and the child side. And I think what's most important is the repair, right? Not trying to prevent or hope that these things don't occur, but having realistic expectations that when we're all here together for many more hours than we're all used to, there will be those times. And so helping parents appreciate the reconnection time, the repair time, and the lesson that is learned by children that that's normal, that's part of relationships, and that your relationship can survive, those difficult moments and in fact, be stronger.
Yeah, that's so important.
I'm wondering about children who might be experiencing family loss in the home, and so as well as things happening that are highly disruptive. And I've heard all anecdotal about children engaging in behaviors that are surprising parents, like regressing in toilet training or having night terrors and those kinds of things. And I think I'd like to encourage the professionals on the call that when you're speaking with families is reassuring them about that these are the way children respond to stressors and challenges. They don't need to panic, that we don't need to overcorrect or get too, I don't know, I don't have a better word than freaked out about those things that you're seeing in your child, because this is really a really stressful time for everybody. But I think families may be experiencing that, and you might be the only person that they can talk to about it without feeling a sense of judgment. And you could offer your support. So I want to remind people that you can upvote a question if you look in the question pod, or enter your own in there. And while we're on the top, I'm going to go to one more, but before we leave the topic of behavior, one of them that has come in was about someone who's supporting a family, and they were in the process of determining that the child may have some features of autism spectrum disorder, and moving that child ahead towards getting a diagnosis or an assessment. And she's wondering, she or he's wondering, do I still navigate that on a phone call with that parent? Or what would be our best advice there? Do we say, let's get through this and we can revisit that? Or do we follow the lead of the families? Erin, you've done a lot of work in autism. What would you say to a teacher about that?
I would follow the lead of the family for sure. Well, I don't want to say for sure, but I think I would follow the lead with the family, and that I would, because perhaps right now that label doesn't matter as much as supporting the family during this time, and supporting the family and supporting their child during this time. If the family is, reaching out and really wants to know and seems to be really seeking kind of a definitive answer, then you might talk through kind of what you saw or what happened during the evaluation process. But I don't know, to me, that doesn't seem as important. And I also think it probably depends on the relationship you have with the family. And I wouldn't want to add something new to a family who I wasn't somewhat confident that I had a good connection with already, because that's a big additional stressor, for many families right now. And I would want to be able to support them through that in a way that I knew I was being supportive and helpful. And so I think I likely would do the best I could to support the family and supporting their child without adding much more to their plate right now. Also because it doesn't necessarily, at this point, for many people anyway, and as far as I understand it, wouldn't necessarily translate to a bunch of different services, right? Because they're not in school. So I would really carefully weigh that right now, and I would mostly be concerned with my ability to connect with the family and my ability to support the family in supporting their child.
Erin, I would just add, not surprisingly, are totally on the same page, right, about following the parent's lead. And I think it really depends, as you said, on the relationship you have with the family and where you're at in the process. I mean, I can imagine a scenario where you have a very strong relationship already with the family and they're really anxious about that information, and they are home and they have time, you know, or the opposite, right? Or they're totally stressed, and as you said, this would be one more thing that they just couldn't handle. But you know, it's the full range of those possibilities, right? And so, you know, really asking the family, here is where we left off. You know, what would be most helpful to you right now? Can we put a pause in that and just focus on helping you during this time, and the strategies that might be most helpful at home, or, you know, just talking about how you manage your own stress right now, or, you know, really helping as a provider, families identify what would be most important to focus on right now to reduce their own stress and to support their relationship with their children during this time. And, you know, that could be any number of things for a family. I mean, it could very well be that the family say, I've been, you know, waiting for months for this information, and I have time to process and connect. And so, you know, I just think asking and being really transparent about your worries and your own concerns. And, you know, you could share with a family, you know, I'm worried if we continue on this, it may not address your needs in this moment, or we may not have enough time to process it. Or, you know, I would just be as transparent as you can and ask families what's on their mind and what would be most helpful to them.
Great. I knew y'all would have great responses to that. So we did have a lot of people speaking to their worries about families who don't have access to technology, and yet we're putting so much stock in, and there's so much all over the internet about Zoom meetings with preschoolers and families, and, you know, getting that face-to-face. Can we do a FaceTime? Can we do a Facebook Live? But some families don't have access to technology, and that's a big worry. It's a worry about equity, and it's a worry about support. So thoughts about that?
Well, I have a colleague recently who told me about, she's actually a therapist and has some clients who don't have access to the telehealth or the, you know, the computers or the internet or the apps and things like that. And so she has been, she shared with me that she's been doing phone conversations, you know, just old fashioned phone. And, you know, it's been very successful for them. So I would just say, don't rule out, you know, those sort of, you know, old fashioned ways of communicating. And, you know, if you want families to have access to something, you know, you can print it out, or, you know, drop it off. You know, put things in the mail. I mean, really going back to basics, but don't discount, you know, the value of those phone conversations. You can do a lot over the phone. You can, at the minimum, you know, just connect and talk, but you could also do some other, you know, depending on where the family is and what they need, you know, share strategies, send things, you know, drop things off that they can look at and you can talk through together if that's appropriate.
Yeah, and also like texting, you know, I mean, they might not have a laptop or might not have an iPad, but even phones that aren't smartphones often can do texting. So if the family doesn't necessarily want to talk on the phone for a long time, you can text reminders, or maybe they have access to email, but no, you know, camera. You can send emails too. So yeah, definitely there are other ways to connect. Around here, there are places that are doing like drop-off sheets and stuff for school. So you can pick up like a packet of materials. Families can pick up a packet of materials actually at the same place where they can pick up meals from the public schools. And so that's another way to connect with families.
The other thing I don't want to leave, you know, when I was thinking about this question is, you mentioned it, Lisa, this idea of equity and, you know, being able to, in fact, access technology where they can't. And I do know there are some really creative things happening in communities where, you know, the bus comes with the internet access and, you know, and so maybe helping see, you know, what's available in the community. I know many schools have dropped off laptops or, you know, helped provide internet access to certain communities that didn't have it. And so, you know, the phone and the basics and the, you know, printed material is awesome. And, you know, we need to continue to advocate for our families to be able to access what others are afforded.
Yeah, and I think, you know, one of the things I've been really pleasantly surprised with is the creative ways that people are coming together and supporting each other in communities. And that is, you know, one of the things I've seen is people are, you know, sharing and giving away iPads and those sorts of things. So I would encourage everybody to really look at their communities and see what resources exist and help families access those.
Yeah, and for people who are practitioners, professionals working with families, I mean, so we have our families ultimately we're there to support children and families. You're interacting with families. You're not in your school buildings to be able to talk to your supervisor or in your wherever you operate out of, your agencies or your programs. So you're really the, you know, pivotal in having sense of what families' needs are and to bring that to the attention of whoever could help you with problem solving that. So I know that's a new role for many of you, but I think that's really important. And it feels to me like in communities, people are really trying to do the very best they can. And it's a little bit of a moving landscape, always dynamic, like first we're doing this, oh, well, that didn't work, let's try this. So think about bringing the message about what families of young children need to your supervisors, to your community, to community agencies that are trying to problem solve this, so that if we're prolonged in this status for much longer, that we come up with better solutions for supporting all families. I want to remind everybody you can upvote some of the questions. We have a little bit of time left. And the one that got upvoted the most is good and related to this, where a person on the webinar is worried that she might be, it's Marjorie, messaging too much. And what's the recommended amount of time that would be not overdoing it? How do people figure that out?
I've heard this a lot from people. So the first thing is you're in it with others who share the same challenge. But my first thought about that is really to ask families. You know, I've heard practitioners talk about, I've sent 5 emails and I haven't heard back, or I don't want to be a burden. I don't want to be another thing they have to worry about. So I think continuing to outreach, I think what I have heard is that families do appreciate it, even if they can't have time to respond, or even, I have heard less of it being a burden in terms of, you making those outreaches, but then, asking families, like, is it okay that I send you an email once a week or every other day, or would you prefer that I not? Is it stressing you out? Is it too much? But really trying to engage families in, is this helpful or is it not helpful? Is it adding to, your already full plate? And, again, taking the family's lead about that.
That's great.
I agree.
Here's an interesting one. I'm seeing about 12 families right now through telehealth, 1 to 2 times a week. I check in on their stress levels and regulation. Right now, I'm asking what was one thing that went really well this week and what was challenging, which I think is a lovely conversation starter. But this participant is wondering, are there other great ways to get families to begin to open up a little bit more about their regulation and their mental health well-being? Any ways to open those conversations? Ideas about that?
So I think one thing they could do is they can share experiences that they're having, perhaps, and that might be a good way to get families to engage in that sort of conversation. Mm-hmm. They can ask families about, I mean, you know, you could just ask families, right? I mean, you could just say, you know, how are you feeling about your ability to, you know, support your child's emotions these days? Or has your child shown any behaviors that were surprising to you?
That's a good one.
Yeah. We talked about some of the questions earlier on, but we could revisit, you know, sort of those questions of how have things changed? How are you doing today? You know, I mean, keep it really focused in the present moment. And as Erin said, you know, I think when we share, you know, some days are really hard and some days are not as hard. And some days I feel all of that, you know, within the last 10 minutes, it can help normalize those feelings and can help generate, you know, parents to feel like it's okay to say that. Another question I like is, you know, what's the hardest part of this? But I also would caution us to, you know, there's always the pressure, I think, or we want to be helpful, right? And so we want to hear how hard, you know, if it is hard, we want families to share. And, you know, sometimes we might not hear that until later, right? It's just, I need to get by day to day, and I can't, you know, really be reflective of that right now. I'm trying to just survive. I'm trying to just put one foot in front of the other, and it may not be as helpful to kind of unpack all of that right now.
That's a great point. I think even for myself, some days I feel like I've just survived, but I absolutely don't want to reflect on how it went. And, you know, I think families that might be exactly what's happening some days too. They just might not want to talk about it. It wasn't great, and they don't want to talk about it again.
Right. And we had a participant who's a special education teacher, is worried about IEP goals and what's going to happen. Do we have any guidance there for that participant?
Well, I think we don't know, and I think we're going to have to be okay with that. And I think what's most important is that we support children through this major, you know, potentially big change that's happening, and that when we are, you know, as long as we are doing the best we can to really support families and supporting their children and being responsive and keeping those connections going, then we're going to be more likely, of course, to be able to address all those other goals that children have, those important goals that children have. But right now, really, given all the, you know, potential trauma and stress that's happening for families, what's most important is that we get through this and keep our relationships intact.
Yeah, it also seems like one thing, if there are things on the IEP you're particularly concerned about children maintaining, if you do a little pre-planning on your guidance with the family about how they do that in a family-friendly, embedded instruction and play and routines, and be really specific. So those infographics are so great because they really give some good concrete information. And I think we often assume that we'll say, oh, well, you know, when you're preparing a snack, have your child, whatever, you know, step up on the stool, and actually could step up on the stool and down from the stool. Let's say it's a motor goal. You could do that a couple of times and then, all right, we're ready to work, you know. And we kind of think, oh, it's embedded instruction. We all know how to do that because that's what we do. But I think families really need to know, what do I do first? And then how would I stage it? What would I say to my child? And you know that. You can share that with families, right?
And yeah, and I think with that, I think perhaps families aren't going to be ready for it necessarily unless they ask for it, right? So if there's a family who really wants information about how to support a goal, and it might not even be an IEP goal, it might be any goal, right, that children have, then yeah, you know, support the family in thinking about what's currently happening throughout their day and how they can embed, as Lisa said, by making some minor changes to what's already happening in the routines or activities that are going pretty well for them, that aren't already difficult. Then think about, be really creative and just think about what are some times that children can practice this, you know, that won't involve a whole lot of changes to what the family's doing.
Well, and as I'm listening to that, I'm thinking of how freeing that could be to know that I might already be doing a lot of those things and might not be, you know, conceptualizing it as, oh, we're working on the IEP goals, or we're working on fine motor, or we're working on social emotional, you know, because you know, if I'm a parent who that's not my field, but then to hear from a practitioner to say, you know what, when you're reading the story and when you're identifying what is the character talking about or feeling, or when you're, you know, putting the laundry in and they're throwing it in with you, you know, that's working on their motor skills, or, you know, I mean, and how that could help them feel like, I don't have to set, you know, this separate time aside and sit down and, you know, do this whole extra kind of thing, but that, you know, oh, wow, like I'm actually doing okay. Like we're doing some of these things. I just may not have realized, like I, you know, am working on this.
Mm-hmm. And it also doesn't even have to happen every day, right?
Right.
You know,
Right.
when it happens.
Right. Right. I think we were having a little chat before we started about that this isn't the time to panic about children's loss of learning. Really, it's a time to support kids and stay connected to them so they're ready, and feel supported and connected and can engage in learning. So this was a great conversation. Thanks.
Lisa, before we move, can I just add one, you know, sort of question for us all to think about is, you know, what will kids remember from this time, you know, and they won't remember, or we don't want them to remember, like we had to sit down and work on these skills every day and how stressful that was, you know, but rather, you know, look back and either think, it was fine, you know, because then it wasn't traumatic. Or think like, I got to spend extra time with mom and dad and, you know, it was cool. Like everybody was home and, you know, so kind of helping families think about like, what will kids look back on their experience and whether they can articulate it or not because of their, you know, their current developmental age, but they'll have a feeling about what that time was like. And so that's kind of the long range view of a question to remember.
That's a good one. It's a good one for all of us to think about, right?
Yep.
So I'm going to pop the screen back up because I wanted to let y'all know that we would like your feedback. We can do another one of these, and if you want to include that in your feedback or what you want us to focus on, we'd be happy to do that. We are, if you don't get the survey link, then you could use this as your link, and go to NCPMI if you want all that great, if you want to find Erin's great infographics or any of our materials. Don't forget about challengingbehavior.org. Hopefully that's how you found your way to the webinar. So in your feedback, if you have ideas of things you want us to address or resources you'd like us to develop that will help you do this work in a better way, that would be terrific. And lots of great things in the question and answer pod, lots of great ideas that were shared. I'm sorry we couldn't share them all here with everyone, but hopefully you had a chance to scroll through and read them. And thanks everybody so much for coming. Have a great weekend.